Congratulations to our 2021 Parkinson School graduates. We are proud of each and every one of you, and we will not let the pandemic distract us today as we celebrate your achievement, a major life achievement of commencement. Whether you are entering the workforce, returning to your career, or starting a new phase in your education, we celebrate today's beginning for your next chapter in life's journey. As Parkinson graduates, we trust that you will, as St. Ignatius of Loyola advocated, go forth and set the world on fire. Both your Loyola and your Parkinson education calls you to be persons for others in 5 critically important ways. First, you are called to improve health equity. This is so central to Loyola's Jesuit values and social justice mission. And we know, and the last year has further underscored, that we must address racism and all social determinants of health if we are truly to address the health disparities we see around us. Your mission is to be called to be problem solvers, working with others in interdisciplinary collaboration. It takes a village to solve complex health problems, whether that be for individuals, communities, or healthcare systems. At Parkinson, you often worked across departments, schools, campuses, and with community and healthcare partners outside the university. I hope you keep that approach in mind and continue to seek out cross-sectoral partnerships for better solutions. You're called to translate your knowledge into action with urgency and purpose. Use your experiential learning and applied scholarship for good. You are our society's next health missionaries and change agents. And with that, you are called to be the health entrepreneurs of tomorrow for social good, whether that be in public health or healthcare settings. Your skills, your intellect, and compassion, paired with the Parkinson School's entrepreneurial spirit, I know will serve you well in solving the tough problems and in scaling and sustaining those solutions. You are called to be lifelong learners, and at the core of Ignatian spirituality is our major source of renewable energy. Finding God in all things and experiencing wonder, hope, joy, connection everywhere, with all and in all. I hope you never lose your curiosity and delight in discovery. So as you leave Loyola and the Parkinson School today, we hope you take us with you. Stay in touch. I would now like to welcome our student speaker to provide some remarks. Carrington Aquila Danielle Jones is receiving her Bachelor of Science in Healthcare Administration. Welcome, Carrington.
Thank you, Dean Morato. Resilience, the capacity to recover quickly from difficulties, from toughness. And you are the epitome of resilience. Hi, class. My name is Carrington Jones, a graduating healthcare administration student, co-founder and co-president of Financial Flex, second vice president of Lambda chapter of Delta Sigma Theta Sorority Incorporated, and I'm sure that I'm not alone in saying that this is not how I expected my undergraduate experience to end. We as a Loyola community, country, and world have faced the unimaginable, and I am immensely proud of each and every one of you for pushing through a pandemic and taking care of yourself and others in every capacity to get to this point. You also deserve my admiration for extending yourself in complete uncertainty to connect and network, and also for advocating for yourself and asking for help, extensions, and guidance. With that being said, I want to tell you a story of how I almost forfeited my opportunity to share this moment with you here today. At the end of my freshman year, my friends hosted a surprise goodbye party for me as I made the decision to end my educational journey here at Loyola for a series of reasons, many of them stemming from my experience as a Black student. From the cultural insensitivity surrounding Black History Month to constantly serving as the spokesperson for all Black people since I was the only one in my class. However, chief among the reasons I decided to leave Loyola was that all semester I would sit in classes learning about the inequities and inequalities that I had experienced firsthand. In these classes, I came in contact with those who were concerned and wanted to make a difference, and also those who could care less. I saw how people felt about those that come from the same socioeconomically disadvantaged communities I come from, and to be frank, I was heartbroken because there were people who claimed they wanted to make the world a better place, but couldn't even address their own biases. But the summer after my goodbyes, I was quickly reminded of the stressors and hardships that plagued my community, my own family. I took a closer look and had an epiphany. I discovered the connection between health, lack of resources, and the hardships we faced on a daily basis. From then on, it has been my mission to make a tangible, positive impact on the world. With that mission, I started with my immediate community at Loyola through the Black Cultural Center, the Student Diversity and Multicultural Affairs Office, and Black Girls Meet. I contributed to enhancing the Black student experience and helped other students of color feel at home at Loyola. In founding Financial Flex, Loyola's first and only student-led financial literacy initiative, I was able to help instill financial literacy in myself and my peers who did not receive those lessons as children. In joining the most magnificent Lambda chapter of Delta Sigma Theta Sorority Incorporated, I have been able to connect with other Black women in serving the Chicagoland area through economic development, educational development, international awareness and involvement, physical and mental health, and political awareness and involvement. Now I am here, serving as the commencement speaker for the Parkinson School of Health Sciences and Public Health, the school that has kept us all together, who continues to support us in every way possible in and out of the classroom. And looking back to my goodbye party, it bewilders me to think that if I had followed through with leaving Loyola, none of these things would have happened. I like to think that that is resilience at its core, the ability to overcome difficulties and excel. But my question is, what about you? When you first walked through those green doors of Cudahy, what did you imagine your experience would be? Has your mission changed? Have the injustices discussed in our classes touched your heart in a way that will inspire you to change the game? Now, think of the future of healthcare, its access, equity, policies, and even management. When I look toward the future, I am filled with the same ambition that brought me back to Loyola. Except for this time, my target isn't just my immediate community, it's the world. I'm motivated by the problems that plague our healthcare system, such as the Black mother and infant mortality rates, communities suffering from relative deprivation, making them more susceptible to crime, hunger, and homelessness, which happens to often be our communities of color. And let us not fail to mention how disproportionately Black and Brown people have been and continue to be impacted by the COVID-19 pandemic, including higher rates of death and lower access to vaccines. These facts affect me to the very core of my being, and my commitment to addressing them is my main priority. We have spent our entire collegiate careers learning about the causes of inequitable health, hearing about the injustices patients face, and becoming experts in healthcare operatives. And with that, you and I now possess a lot of power. We have the power to address and identify wrongdoings in all of our respective healthcare spaces, to connect individuals and families to healthy resources and insurance. We have the power to not only lessen the risk for diseases like diabetes and heart disease that are tearing through our Black and Brown communities, but to increase life expectancy. So in that vein, let us set our intentions. Let us never accept the status quo as acceptable and effective within our systems, hospitals, health centers, and communities. Go forth and set the world on fire. With your creativity, devise solutions to problems, old and new. Build new infrastructure. Allow your personal experiences to shape your journey, and never make or take excuses. As Bob and Elizabeth Parkinson once said, access to quality healthcare is a right. And good health is the foundation for strong families, individuals, and communities. And as graduates of Loyola's prestigious Parkinson School of Health Sciences and Public Health, we are equipped with every tool needed to enact the change we wish to see. I believe in us all, and I am honored and eager to witness the impact we will have on this world. As Dr. Sharpucci has reassured us, we are the future of healthcare. Well, now the future is finally here, and we are ready to give it our best shot. Thank you. I would now like to welcome back Dean Murato to provide some final remarks.
Thank you so much, Carrington, for your wonderful remarks. The class of 2021 will now be individually recognized for their achievements. And on behalf of the Parkinson faculty, staff, and students, congratulations. Now go set the world on fire.
I would now like to present the candidates for the degree of Master of Public Health and Bachelor of Science Environmental Sustainability. Amanda Morgan Cushion. Roshandeep Singh. Dina B. Vavaroutsos. I would now like to present the candidates for the degree of Master of Public Health. Sydney Ann Ackler. Sayeda Bushra Ansari. Sonia Aurora. J. Bradford Hampshire Bertuman. Lindsay Buckholtz. Curl C. Colbert. Mackenzie Lee Defferner. Nicole Ditto. Madison Elizabeth Ellen. Katie Evans. Yasmin Marie Gilliana. Thomas Matthew Halverson. Bryce Jamel Jones. Yanni Caldas. Sania Khan. Anthony York McIntosh. Sophia Regina Ottomanelli. Sagar Patel. Tierra Mercedes Kiala. Sarah Rothenberg. Jennifer Taylor. Peter Varghese. Jessica M. Yunez. I would now like to present the candidates for the degree of Master of Science in Dietetics. Amanda Jean Babarskis. Abigail Dyka. Kai Ford. Abigail Page Jawless. Jacqueline Michelle Josephiak. Emily Kawettel. Paula Teresa Riley. Therese Seinel. Megan Deneen Worms. I would now like to present the candidates for the degree of Master of Science in Exercise Science. Kevin Ray Ferrer. Kristen Lee Marilla. Marissa Thompson. Colin Joseph Van Eyck. Stephanie Vasquez. I would now like to present the candidates for the degree of Master of Science in Health Informatics. Corinne Bunn. Sujay Kalshrestha. I would now like to present the candidates for the degree of Master of Science in Medical Laboratory Science. Farzana Ismail Arab. Aneta Kramek. Mary Raiva Bahumunde Gagaa. Alicia Trista Gazder. Maria de Jesus Macias Bedoya. Gidget M. Taylor. Kujal Upadhyaya. I would now like to present the candidates for the degree of Bachelor of Science in Exercise Science. Lauren Beth Firmke, magna cum laude. Madison Kathleen Carolyn Colville, cum laude. Jacqueline Camille Durr. Nathan Miles Espiritu, cum laude. Daniela Michelle Gichla. Brandon Gonzalez Bertapel. Jeff Jungwoo Kim. Elizabeth Virginia Moravec. Clark Vincent Gallagher Morin. Ugni Narbutaite. Maggie J. Packer, cum laude. Molly Grace Rickard, magna cum laude. Hannah Marie Rupel. Jayasurya Rao Ruthula. Brian Joseph Santos, cum laude. Kira Calliope Saris. Ifeoluwa Kikilomo Sholeye, magna cum laude. Cole Tyson Smolinski. Marco Antonio Soriano II. Christos Pericles Travlos, cum laude. Mackenzie Elise Westbrook, cum laude. Alexandra Anna Witkos, summa cum laude. Garrett Christopher Zolg. I would now like to present the candidates for the degree of Bachelor of Science in Healthcare Administration. Mohammed Amar Al-Siraj. Ayeshat Folashade Adeniran, cum laude. Imad Mohammed Ali. Benjamin Potzik Amani, cum laude. Mahima Aurora, cum laude. Dafina Bayrami. Patricia Leonore Alaga Barcenas. Fabian Nicholas Becerra, magna cum laude. Abir S. Bershed. Emma Jane Burke, magna cum laude. Angelica Rose Kanata. Hamza Ahmad Choudhury, magna cum laude. Giselle Dominguez. Elma Fazich. David Joseph Gagnon, magna cum laude. Rita Hassan. Brittany Anne-Marie Jarvis. Carrington Akela Danielle Jones. Zoha Khan. Roxana Leck, cum laude. Khadija Mansour, magna cum laude. Morgan Ashley Mihako, cum laude. Alexa Mircho. Irwa Mirza. Karina Monares. Helena Morcos, cum laude. Catherine Ann Nolan, magna cum laude. Vincent I. Oganwu. Himal Badabai Patel. Toro Himanshu Patel. Alexia M. Plaza. Muzaina Quadri. Sabriana Kia Rugi. Vasi Ruiz. Haitisha Deepakkumar Savalia. Rakib Shazad. Oluwakemi Ayomide Shudipe. Jolisa Guadalupe Soto. Megan Catherine Steronis, cum laude. Veena Sundar. Evelyn Rose Vandervoort, magna cum laude. Dana Marie Varghese, cum laude. Andrew L. Vigansky, magna cum laude. Tyler Lewis Watt, cum laude. Gary Francis Zeringue Jr., cum laude. I would now like to present the candidates for the degree of Bachelor of Science in Public Health. Angelica Gill. Samantha Grace Johnson, honors. Eric Stephen Carney, honors, magna cum laude.